question. Now I am going conceptual. In this page, on this page, I will take time. You must have patience and you will solve multiple conceptual question by this flow diagram. I will extend this diagram, means I will club this diagram with lipid metabolism, protein metabolism. Yes, don't worry. Yes, for the time being, just have an idea. Yes, before starting carbohydrate metabolism or carbohydrate, yes, you must know this protocol, how in our body it is being done. Yes, whenever we take diet, yes, suppose we are in fed state. Yes, what I said, we are in fed state. Fed state means we are taking our diet regularly at regular time interval. So I can write here, I am in fed state. Fed state. Yes, you all know fed state whenever we take food. Yes, whenever we take food, blood glucose is increased. Blood glucose is increased. Diet, we are in fed state. We will write to right thing on this page only, so that we can solve multiple questions from this flow diagram. Okay, so I write it as fed state. It is a fed state. Okay, means we are in fed state. We are taking our diet regularly at regular time interval. We took breakfast, we will take lunch, we will take dinner. Yes, in this way. So we are doing all these things regularly at regular time interval, means we are in fed state. And many times we usually say in fed state, usually 4 hours, means whenever we take diet up to 4 hours, that is considered fed state. Means after diet, yes, after diet, fed state is after diet up to 4 hours. Sometimes we say 4 to 5 hours, 6 hours, 4 hours. I take 4 hours better. Okay, sometimes we say 2 to 4 hours, sometimes we say 4 to 5 hours, depending on the amount of diet we have ingested. So it's not absolute. Nothing is absolute. Yes, why I am saying nothing is absolute, when you will solve question, you will keep in mind each and every line. Okay, because many times, yes, there is no fixed rule, but we usually say, yes, fed state is after diet up to 4 hours, we are in fed state. Yes, you all know, I write here. When we take diet, I write here, you may write on the same end, so that it would be as small as possible. And yes, the purpose, again I am telling you, I want to give you least mental picture in a particular subject, so that you can revise it faster. Okay, yes, if I write here, yes, that a patient, yes, we are in fed state. Yes, if after taking food, when we take food, after food, blood glucose increases. Yes or no? When we take diet, when we take food, blood glucose increases. Yes, liver is the main organ of metabolism. It is the responsibility of liver to maintain blood glucose. What I said? Yes, liver is the main organ of metabolism. It take care of blood glucose. Whenever we took food, blood glucose increases. Liver will take this extra glucose and will convert into glycogen. So that it can maintain normal blood glucose level. You know, if blood glucose is high, that is diabetes. If blood glucose is low, that is hypoglycemia. We all know. So liver take extra glucose from blood and convert into glycogen. You all know glycogen is a polysaccharide made up of so many glucose units. In between meals, yes, in between meals, or sometimes in fasting, suppose you took breakfast and we don't take lunch, and we continue our class, or whatever we do, we don't take lunch, we could not get time, and we continue our class, yes, till evening. What I said? Yes, we continue our class till evening. Would be there any hypoglycemia? Please do reply. No, there would not be any hypoglycemia. We took breakfast, blood glucose increased, liver took this extra glucose, converted into glycogen. Now, in between meals, means up to night, yes, my blood glucose will be maintained by this liver glycogen will be broken down. Broken down, I can write it is broken down to maintain blood glucose. Okay, so glycogen will be broken down to maintain blood glucose. There would be no hypoglycemia. Recently they asked question, give me answer of that. Yes, before that I would like to, liver glycogen is sufficient. What I said, liver glycogen is sufficient to maintain blood glucose up to 16 to 18 hours. How many hours? 16 to 18 hours. Means liver glycogen can maintain blood glucose up to 16 to 18 hours. Means if we started class in the morning and we don't take break till 4 a.m. 4 a.m. even then we will not have hypoglycemia because blood glucose will be maintained by liver glycogen. Why I am taking more time? Trust me, it would be useful for you. I would take little bit slow initially, gradually I will increase the speed. Okay, because blood glucose is maintained by liver glycogen and liver glycogen is sufficient to maintain blood glucose up to 16 to 18 hours. Recently in INICT question was asked, you took breakfast in the morning and you took blood sample at evening 8 p.m. You took breakfast at 8 a.m. and you took blood sample at 8 p.m. I say breakfast, yes, breakfast at 8 a.m. and measure blood glucose at 8 p.m. and blood glucose was 180 milligram per deciliter. What is the source of this extra glucose? Question, yes, I can write question here. Yes, 8 a.m. 8 a.m. breakfast, yes, 8 p.m. sample and blood glucose was 180 milligram per deciliter. What is the source of extra glucose? Source of extra glucose. Yes, they asked this question, what is the source of extra glucose? They had given this 180 milligram. I am very sure every student told that 180 milligram per deciliter was told, and in fasting state if 180 milligram per deciliter is there, it is diabetes. In diabetes, extra blood glucose is maintained by gluconeogenesis. Yes, definitely liver, but not by glycogenolysis. Gluconeogenesis. So again I am telling you, each and every word is important. This time every student is saying, whosoever got selection, even that person is saying we were expecting some more marks but not got sufficient marks which we were expecting. The reason is that they are playing with the words. So in the same question, if I don't mention this 180 milligram, yes, the answer is liver glycogen. Yes, the answer is liver. If I don't mention, the answer would be liver glycogen. Got the point? But if they gave what is the source of extra glucose, it is diabetes. So they want to ask you that this is not a normal situation, this is a pathological situation. In diabetes, blood glucose is maintained, increased both by glycogenolysis and gluconeogenesis, but the extra glucose is being contributed by gluconeogenesis. Got this point? So I put this in box. Yes, this question recently asked, and now you remember that if they said it is 8 a.m. breakfast, 8 p.m. sample, what is the source of this glucose? You will say this is glycogen. But if they give 180 milligram, means it is diabetes. In diabetes, both glycogenolysis and gluconeogenesis is there, but when they said this extra glucose, we will prefer to mark the answer gluconeogenesis, because they pointed out that this is diabetes. Is it clear to you? So now I told you that this is fasting state up to 16 to 18 hours fasting state. What I said, up to 4 hours, fad state. Up to 16 to 18 hours, this is fasting state, early fasting, and blood glucose is maintained by glycogenolysis. Clear? Good. So now I took food. As I took food, blood glucose increased. Yes, because in our diet, 60-70% of our diet is carbohydrate. Yes, in PSM sometimes we say 50-60%. Yes, now we say 60-70% of our diet is carbohydrate, 15 to 20% lipid, rest is protein. So main constituent of our diet is carbohydrate. When we take carbohydrate, blood glucose increases. This is blood glucose increases. This extra glucose go to pancreas. In pancreas, this glucose increases the insulin secretion. Yes, goes to pancreas and increase insulin secretion. What is the function of insulin? Yes, I will write here only. On the top of this. Yes, pancreas. Main function, you will write in the same way. MAIN, capital. Main function of insulin is to decrease blood glucose. Means the only and only goal of insulin's life is to decrease blood glucose, just like goal of your life is to get the PG seat. In the same way, main function of insulin is to decrease glucose. Any reaction which will decrease blood glucose will be activated by insulin. I write here, any reaction which decrease blood glucose will be activated by insulin. Any reaction which decrease blood glucose will be activated by insulin. So now I see, this is blood glucose, extra blood glucose. Now we want to decrease blood glucose. What will happen? This, if I convert all the extra glucose into glycogen, then the blood glucose will decrease. Means I diverted this extra glucose, yes, to glycogen. Glycogen is a polysaccharide made up of glucose, like this. This is glycogen, which is present in liver. So whenever we take diet, blood glucose increases. This increased glucose go to insulin. Insulin pancreas release insulin. Now insulin will try to decrease blood glucose, means it will divert glucose into glycogen, and more glucose will be converted to glycogen, and yes, blood glucose will decrease. In glycogen synthesis, for the time being, just mug up, don't worry if you don't remember the rate limiting enzyme, it's okay. For the time being, just mention, yes, I write glycogen synthase. Glycogen synthase. Yes, glucose is converted to glycogen. The rate limiting enzyme is glycogen synthase. I am telling you initially so that when we will discuss glycogen synthesis, at that time you will be familiar why all these things are occurring, and the remembering of enzyme would be simpler. Okay, so glucose is converted to glycogen by glycogen synthase, and this glycogen is stored in liver. Glycogen is stored in liver, yes, but liver has limited capacity, means liver can accumulate glycogen up to 5% of its weight. Question: liver can accumulate glycogen up to, yes, glycogen up to 5% of its weight. Okay, means it has limit. Now please give me answer. Insulin want blood glucose to be decreased, so if glucose is converted to glycogen by glycogen synthase, so insulin will activate glycogen synthase or inhibit glycogen synthase? Please do reply. Please do reply. Insulin will activate glycogen synthase or inhibit? Again I am saying, yes, if you remember this, all the answer, all the conceptual question would be very simple. Trust me. Previously I used to teach that it is metabolic. Yes, yes, activate. This is anabolic, this is catabolic, but now the trend is changed. Now they want you must know the each and every integrated step, so they can ask you any intermittent part. Clear? So I say that you took food, blood glucose increases, and we know that whenever blood glucose increases, we know that if blood glucose remain increased, that is diabetes. That's why, yes, increased glucose will go to the pancreas. It goes into pancreas. Pancreas and insulin. The only goal of insulin life is to decrease blood glucose. This insulin will go just like hide and seek. This insulin is, yes, on den. Insulin is on den and he is searching glucose. Now glucose are running. Glucose are running. Few glucose molecule rain, yes, and yes, entered the liver. And when they entered the liver, they filled the liver with the help of glycogen. 5% of liver is glycogen. Yes. After that, it can't accommodate more glucose. You must have played that hide and seek. Whenever three children are already there, and you go to hide there, and you find already there is full, they will push you. No more place. In the same way, when glucose came here, yes, up to 5% they will accommodate. After that, they will not accommodate. So now this glucose will think that insulin is coming. What should I do? Insulin said, okay, glucose said, okay, I will do glycolysis. Means blood glucose is decreased, should be decreased. So some glucose entered the liver. Now, yes, insulin will activate this glycogen synthase. So any reaction which decrease blood glucose is activated by insulin. Now this glucose will run towards glycolysis. Glycolysis I will discuss in detail. Glucose is converted to two molecules of pyruvate. This is glycolysis, and the rate limiting enzyme is phosphofructokinase. Even if you don't remember the name of enzyme, I am comfortable. You should be comfortable. This is glycolysis. because when I will discuss glycogen synthesis, glycolysis, HM patient, at that time it would be very discussed in detail, but at that time you will be able to remember that why this is occurring. Okay, so this glucose thought that I should enter the different cells and start glycolysis because insulin want there should be no glucose in blood. So now this from this blood everybody is running, every glucose is running, few enter the glycogen, few ran towards different cells and they entered the glycolysis. They entered the glycolysis, and you know glycolysis rate limiting enzyme is phosphoroctokinase. If all the glucose molecules from blood enter different cells and start glycolysis, blood glucose will decrease and insulin wants that. So insulin will activate phosphofructokinase or inhibit phosphofructokinase? It will activate. So I write here green color, activate glycolysis. Clear? Yes. This pyruvate, yes, pyruvate, yes, will par करना, cross करना. This is inner mitochondrial membrane. क्या लिखा मैंने यहाँ पे? Inner mitochondrial membrane. Wherever I am writing, if you write, you will not be congested. Yes, I have planned in a very structured way. In last, you will be able to revise. Trust me. Okay. Yes. Okay. Yes. सो पायरुवेट पार कर जाएगा. सॉरी टू बी इन हिंदी, क्रॉस करने को पार करना कहते हैं. यस, द क्रॉस करना, यस, टू क्रॉस एनीथिंग, इट इज टू पार एनीथिंग. ओके, दैट इज हिंदी. सॉरी, बट पायरुवेट विल क्रॉस the inner mitochondrial membrane. You know, inner mitochondrial membrane is very selective. It can allow some compounds to enter, it don't allow some compounds to enter. So pyruvate पार कर जाता है, but pyruvate will wait. Name अपने आप says you, pyruvate will wait. Wait for which? H ion. Pyruvate will wait for H ion. When H ion will come, pyruvate will enter the mitochondria. Question is asked, pyruvate enter the mitochondria with the help of H ion symport. With the help of H ion symport, pyruvate will par, but it will wait for H ion and it will enter the mitochondria, and further metabolism will occur in mitochondria. This pyruvate is converted to acetyl coenzyme A, and the name of this enzyme is pyruvate dehydrogenase. Pyruvate dehydrogenase. Okay, pyruvate dehydrogenase. So this pyruvate dehydrogenase convert pyruvate to acetyl coenzyme A, means if you divert glucose in this direction, so pyruvate dehydrogenase will be activated by insulin. It is activated by insulin, because if this reaction is going in this direction, yes, don't draw this, yes, in this direction, then what will happen? Glucose will decrease. Now this pyruvate dehydrogenase convert acetyl coenzyme A, and one acetyl coenzyme A, yes, it is totally factual, I can understand. It is only mug up things, I know. But when we will discuss individual topic, then it would be helpful for us. For the time being, even if you don't remember this, it's okay, because I will discuss it multiple time when I will do different questions of recently asked. At that time I will try to solve those questions with this flow diagram. Then you will remember, after this class you will remember this pathway very easily. It would be imprinted in your mind. Okay, so 2 acetyl coenzyme A, we say 1 acetyl coenzyme A enter Krebs cycle. We all have heard that Krebs cycle occur in mitochondria, and we all know that acetyl coenzyme A enter, yes, Krebs cycle and produce 10 ATP. Question is asked, 1 acetyl coenzyme A enter Krebs cycle to produce how many ATPs? 10 ATPs. So if I say don't draw, yes, just listen. If I say this glucose is being diverted to this direction, then blood glucose will decrease. So all these pathway will be activated by insulin. If more and more acetyl coenzyme are entering Krebs cycle, then then blood glucose will decrease. So Krebs cycle should be activated by insulin or not? Please do reply. Please do reply. This is important question. Krebs cycle should be activated by insulin or not? No. Krebs cycle is not under hormonal regulation. Krebs cycle is not under hormonal regulation. Not under hormonal regulation. Yes, it is not under hormonal regulation. Yes, why? We say for the survival of cell, energy is required. For the survival of cell, what I said, for the survival of cell, energy is required, and energy, main source of energy is Krebs cycle. You will find that all the dietary compound, yani carbohydrate, lipid, protein, if they want to produce, I write like this and you also write like this. If carbohydrate, lipid, protein want to produce energy, they produce energy by Krebs cycle. They produce energy by Krebs cycle. So that's why we said that this Krebs cycle is very important for the survival of cell. This should not be under control of hormone, otherwise it would be very difficult for the cell to survive. If hormonal disturbance is there, if diabetes is there, Krebs cycle will not be there, cell will die. That's why what nature did, nature said Krebs cycle would be out of control of hormonal regulation. It will be regulated allosterically, means local factor. It would be regulated by local factor. If cell require energy, then it will continue. If don't require, it will stop. So Krebs cycle says no, I am not under hormonal control. I am taking care of the cell. If cell require energy, I will perform. I will produce 10 ATP from one acetyl coenzyme. When energy requirement of cell would be fulfilled, then I will not use acetyl coenzyme A. So it is not regulated by insulin. So remember, this is very vital. Is I highlight it different color. Yes, it is very vital. If, and that's why many times you will see in medicine and other subjects, if any mutation occur in the enzyme of Krebs cycle, that mutation is lethal, because cell can't survive, because all dietary component, it may be carbohydrate, lipid, protein, produce energy by Krebs cycle. I will discuss in detail, don't worry. For the time being, yes, Krebs cycle is independent of hormonal regulation. Yes, so carbohydrate, lipid and protein, yes, all these are ultimately producing energy by Krebs cycle. So Krebs cycle, nature said this is independent, not hormonal regulation, otherwise in diabetes patient will die. That's why we say that yes, in means in the same, that is the reason that if mutation occur in, okay, little bit, yes, definitely I am feeling like that. Yes, now we move little bit faster. Okay, yes, so this is clear. Now this acetyl coenzyme A means, yes, this acetyl coenzyme A, this acetyl coenzyme A, yes, okay dear. So I will increase a little bit pace, don't worry. Yes, Yes. So acetyl coenzyme A, yes, when these glucose molecules, yes, are running out of the blood because of the fear of insulin, they are coming out glycolysis, pyruvate enter the mitochondria, then acetyl coenzyme A enter the Krebs cycle. When energy requirement of cell is fulfilled, Krebs cycle denied that I will not take acetyl coenzyme A, but due to fear of insulin, all these acetyl coenzyme A are being produced. Now what these acetyl coenzyme A will do? These acetyl coenzyme A will come out of the mitochondria. These acetyl coenzyme A will come out of the mitochondria. Now these acetyl coenzyme A are present in cytosol. These are present in cytosol. So acetyl coenzyme A present in cytosol. All these acetyl coenzyme A which were present in mitochondria, now came to cytosol. Now, so this is this pathway is going on. Now, all these acetyl coenzyme are so many acetyl coenzyme, whatever extra carbohydrate was there, all the extra carbohydrate was converted to as yes, acetyl coenzyme is present in cytosol. Yes, in cytosol these acetyl coenzyme has two fate. One is acetyl coenzyme will be converted to, I don't take this. So acetyl coenzyme, so many acetyl coenzyme. I will discuss what are the steps of acetyl coenzyme. Yes, all these acetyl coenzyme may form fatty acid. Question is asked that fatty acid starting point is acetyl coenzyme. Question is asked cholesterol synthesis starting point is acetyl coenzyme. So fatty acid starting point is acetyl coenzyme. Yes, acetyl coenzyme. Yes, now I will write an enzyme. Acetyl coenzyme is converted to malonyl coenzyme by acetyl cos, yes, acetyl coenzyme carboxylase. Yes, I will make you remember all these enzyme by concept also. Don't worry. For the time being, acetyl coenzyme carboxylase form malonyl coenzyme. It will bind with acetyl coenzyme. Whatever it may be, ultimately they form fatty acid. So I can say that this form fatty acid, acetyl coenzyme form fatty acid, and the rate limiting enzyme is this. Okay, so, and cholesterol synthesis, yes, cholesterol synthesis also starting point is starting point is acetyl coenzyme. So now I say what happened, again I repeat. Yes, before summarizing it, yes, it would be very simple. Just few molecules of glucose can enter HMP shunt. I will discuss HMP shunt in detail. HMP shunt produce NADPH. What I said? NADPH. H means reduction. Wherever you want reduction, you use NADPH. Again I repeat. Wherever you want reduction, you use NADPH. Okay, NADPH has only goal to reduce compound. So NADPH reduction. It is not related to energy. NADH produce how many ATPs? Please do reply. NADH produce how many ATP? 2.5. FADH produce how many ATP? 1.5. Yes, I write in the corner so that it should not be affected. NADH produce 2.5, FADH produce 1.5, NADPH produce, yes, NADPH produce no ATP. The only purpose of NADPH is reduction. So wherever you want reduction, you will use NADPH. Clear? So now I say that NADPH is not concerned with energy production. A question is asked, how many ATPs are produced by HMP shunt? How many ATPs are produced by HMP shunt? HMP shunt says, I am not here to produce energy. If you want to produce energy, go to glycolysis. If you want to produce energy, go to Krebs cycle. I am here to produce reducing equivalent, NADPH. So how many ATPs are produced by HMP shunt? Zero, because HMP shunt is concerned with energy production. Now I complete the, yes, mnemonic, yes, or concept. We took diet, blood glucose increases, this blood glucose goes to the pancreas release insulin, now insulin is on den, hide and seek. Now insulin enter the blood, and he said that, yes, where is the glucose? Glucose are running. Yes, few glucose entered the liver, glycogen. Yes, glycogen storage is full. What to do? Glucose said, okay, we should run in glycolysis. They ran in glycolysis. Few glucose thought that better, so many glucose are going to glycolysis, better to go to HMP shunt. There is nobody going. Few glucose enter the HMP shunt. So HMP shunt is activated by insulin. HMP shunt is activated by insulin. This is also activated by insulin. So now glucose are running from the blood. They entered the cell. In cell they started glycolysis. When they started glycolysis, they form pyruvate. Now pyruvate will wait for HN and they will enter the inner mitochondria. They will close inner mitochondrial membrane. You must have seen in hide and seek, we enter the room. From room we enter the, yes, washroom. Yes, multiple places. So in the same way, they entered the room, glycolysis. Then they thought we should hide further. They entered the, yes, mitochondria. In mitochondria, pyruvate dehydrogenase, acetyl coenzyme enter Krebs cycle to produce energy. Yes, when energy requirement of cell is fulfilled, Krebs cycle said, no, I don't want you. Then one acetyl coenzyme start accumulating in mitochondria. So they thought we should go outside from the back door. They came out of the mitochondria, and in my cytosol so many acetyl coenzyme were there. They thought that we should make fat, and fat is deposited in adipose tissue. So these acetyl coenzyme, yes, these acetyl coenzyme form, yes, fatty acid. They form fatty acid. Yes, they convert malonyl coenzyme fatty acid form triglyceride, and they are deposited in fat. Okay, and few acetyl coenzyme cholesterol. So means all these are running, and all these are activated by insulin. These are activated. Cholesterol synthesis is activated by insulin. Fatty acid synthesis is activated by insulin. Acetyl coenzyme carboxylase is activated by insulin. Clear? Now, yes, you know all this pathway. Clear? And I told you that all the carbohydrate, lipid, protein ultimately produce energy by Krebs cycle. How they produce? They can enter Krebs cycle in the form of which compound? Acetyl coenzyme. Now you remember, if I ask you glycogen synthase occur in cytosol, whatever is occurring out of this membrane, everything is occurring in cytosol. If I ask you HMP shunt occur in cytosol, glycogen synthesis occur in cytosol, glycolysis occur in cytosol, pyruvate dehydrogenase reaction occur in mitochondria, Krebs cycle occur in mitochondria, fatty acid synthase occur in cytosol, cholesterol synthase occur in cytosol. Yes, no need to mug up which pathway is occurring in cytosol or mitochondria. Yes, just remember this flow diagram and you will come to know. Okay, now before completing the discussion, yes, I promised you that 30 questions at least from this diagram, and I will solve that. Yes, I make one more mnemonic here only we have space. Yes, so you will remember this hide and seek. Okay, insulin, yeah, I will write like this: insulin insult phosphate. Insulin insult phosphate. Yes, you can easily rhyming insulin insult, initial letters are same, and you know, whenever you insult somebody, yes, he or she will leave you, even if you have so passionate love. Yes, boyfriend, girlfriend, whosoever may be, if you insult, he will leave you. So phosphate will leave the protein. Yes, so insulin remove phosphate from protein. I say insulin remove phosphate from protein. How it removes? Yes, insulin remove phosphate from protein. Yes, insulin remove phosphate from protein, and all enzymes are protein. All enzymes are protein. So this phosphotokinase is protein. This glycogen synthase is protein. This acetyl coenzyme carboxylase is protein. All enzymes are protein. So you can say insulin remove phosphate from enzymes. Okay. So whenever any, and this is recently and frequently asked question, you know that I write here only, there is an enzyme, this is an enzyme. Yes, this is second enzyme. I found that if you attach phosphate to this enzyme, we found this phosphate is activated. So this enzyme is activated. I attach phosphate to this enzyme. Yes, this is inhibited. So there is no rule. We found that in our body there are so many enzymes. Few enzymes are activated by phosphorylation and few enzymes are inactivated by phosphorylation. Means phosphate is high energy compound. If you give any person high energy, few person can tolerate, few person can't tolerate. You must have seen the movie Thanos. Thanos 6 stones, he became more powerful, means got the power, energy, phosphate of stones, and he became more powerful. While Iron Man, same stones, same powerful phosphate, he died. Means if you are competent to tolerate the energy, you will be activated. If you are not competent, yes, you will die. In the same way, in our body, we have seen there are so many enzymes which are activated by phosphorylation, so many enzymes which are inhibited by phosphorylation. So there is a frequently asked question, which enzymes are activated by dephosphorylation? So I say insulin insult phosphate. So insulin remove phosphate. So any enzyme which is activated by insulin will be activated in dephosphorylated state. What I said? Yes, any enzyme activated by insulin is active in dephosphorylated state. Why? So you can remember like this: insulin comes, insult phosphate, remove phosphate from the enzyme, and say now you are active. Means whenever insulin comes, insulin activate glycogen synthase, it remove phosphate from glycogen synthase and activate it. It remove phosphate from phosphotokinase and activate it. It remove phosphate from pyruvate dehydrogenase and activate it. It remove phosphate from acetyl coenzyme carboxylase and activate it. So acetyl coenzyme is active in phosphorylated or dephosphorylated state? Please do reply. Then I will end the session of this portion and we move to next topic. Yes, all these enzymes which are activated by insulin are active in phosphorylated or dephosphorylated state? Dephosphorylated state. Dephosphorylated state. Bubble.
Hi friends. So like, share and subscribe. If you have any doubt, comment below. Thank you.